Bob and Brad, the two most famous physical therapists on the internet.
Hi folks, Brad Heineck, physical therapist.
Mike Keenitz, PT assistant.
And Bob, unfortunately, is not here today. He's taken a hiatus. He's taken a sabbatical. He's not here. But Mike is going to do an outstanding job. And who knows, you might even take over his job. Anyways, we are going to talk today about the dangers of plug-in hot pads, things you must know. Now, Bob, Mike, as physical therapists have been using hot pads in the clinic with patients as long as we've been treating. Yes. They work very effectively, but there are some dangers that we know because that's what we work with. And you will want to know if you have these or if you want to, work with a plug-in hot pad. So, keeping that in mind, we are actually doing a giveaway.
We are, of the Thermotex far infrared hot pad.
Right. So it fits right into this whole video, if you will.
Perfectly. And that's actually probably the superior type of hot pad compared to this.
Yeah. We're going to talk about the technical differences and what the difference is buying a typical conduction hot pad or the far infrared. We'll get to that in a little bit. So shall we continue on?
Yes.
Are you going to talk in this video?
Maybe.
I may babble on so much that I won't give him a chance. So first of all, why heat works. You really want to increase the circulation. You put your hot pack around the injured area. It'll allow the muscle to relax. It can increase the circulation when you're circulation. You want to talk while I'm stuck here?
Increases the blood flow to the area. Your blood carries all your nutrients, helps the healing process occur faster.
And oxygen, of course.
Yes.
Right. And you get rid of the waste products, the carbon dioxide, the lactic acid, whatever else may be there that needs to get back.
It just feels really nice.
Yeah, it is.
Especially during winter.
It's one of those things as a therapist, it's nice to say, we'll put your hot pack on now, and the patient says, oh, thank you. You become, it's a good rapport builder right there.
Yes.
Versus a cold pack. Sometimes they do not.
They don't like you. They make faces at you.
Yeah. So let's talk about this. We've got two different kinds of hot packs here.
Yep.
We've got the plug-in conduction. This is your standard hot pack. You can go to, they've been around for years and years and years.
Find them anywhere.
Yeah, they don't cost too much. They're about $30, $40.
Yeah.
Obviously, the plug-in, they oftentimes have 3 to 4 temperature settings.
Yes.
In order for these to work, they're a conduction hot pad. So electricity flows through them. There's resistance in there that creates heat, and that heat gets to your body through contact. If you're going to heat up your leg, you have to have it touching your leg in order for it to
actually work.
Right.
You can use either side with this one. The far infrared, you can actually only use one side, the way that hot pack's set up.
So with the far infrared, you only can use one side. It'll actually, instead of conduction, it uses light rays. Far infrared light rays, and it works like a sun, or if you're by a fire, you can feel the heat from a fire. That's the same principle. So if I'm going to heat up my leg here, I'm going to put this down like this. I can wrap it around. I've got elastic straps to help it on there, and they work really nice. Now here is the biggest difference, aside from the cost, but there's a reason why this one costs more. The depth the heat will penetrate from a conduction hot pack like that is
1/8 inch.
Right, 1/8 inch versus 2.36 inches. So much deeper with this. So if you've put it on my leg like this, and we've got 3 panels here, I'm going to put it on. It's going to go 2.36 inches in this direction and this way. And that's going to really get deep into the muscle. It's going to get into the joint, get that synovial fluid, the blood circulating at a depth that will not compare to. So that's the big difference.
And I should say I've used both. Well, obviously you have two. And that one, it gets nice and warm, but it doesn't get overly hot. Like I've never had an issue where it feels super hot or hot superficially, where this one I've had that issue before. So,
and which brought me up to the question, how hot do these get? Well, I looked it up, and Thermotex, they have a nice website, and they said this gets up to 100, I think 16 or 17 degrees is what they had. This one, I didn't know, and this has 4 different temperature settings. So what I did is I took a thermometer made for putting in your meat to see how hot your meat is, and I thought, well, I'll use
Did you
it.
clean it off before you
Of
put it
course
on?
I
Oh,
did.
just checking.
As a matter of fact, I even tested it to make sure it was accurate by I cleaned it off, put it under my tongue, and then I took my oral thermometer that's made for putting under your tongue, and the difference was 0.1 degree Fahrenheit. So I felt that was going to work out well.
These are the scientific methods at Bob and Brad.
Whatever, I'm using the same thermometer. This is a digital thermometer.
It still works same.
Now, what I did with this one, I folded it over, I put it on the table, I put the thermometer, which is about 4 or 5 inches long, the needle in there, and I left it there for 5 minutes until the temperature stabilized.
Yep, and he has 4 settings on here, just
Right.
FYI.
And this only has on-off, so I did the same thing with this, put it over there, and I waited longer. I went 15 minutes on this because fire infrared heats up slower, quite a bit slower, but it goes quite a bit deeper. So you leave this on longer than you would that one. So here are the temperatures. This is interesting. I thought it was interesting. For the low setting, that one went to
110 degrees.
the next setting up.
Well, that was warm. Low was 124 degrees.
Right.
Medium was 134, and high was 145 degrees. And this has a 15 to 20 minute time limit.
Now, and that's what they recommend. That has the automatic shut off at 2 hours.
Oh.
Now, we're going to talk about precautions. Now you can start to see why maybe you can get burned. You can burn your skin with these temperatures if they're not used properly. Now, the Thermotex, on my thermometer, went to 119 degrees, and it leveled off there. Again, the factory said 116, and it might be just that my meat thermometer was off a few degrees. Either way, the temperature between the two is quite different because we had the same thermometer, and 145 to 119.
Yeah.
All right.
Big difference still.
So
some precautions
yeah,
you should follow for either
Yes.
of these is never put them directly on your skin. You should always try to have one layer of clothing.
Yep.
And be cautious if you have very fragile or thin skin.
Right. I would say if you just have one layer and you have an elderly person or with fragile skin, actually take a towel, put it over, and then put the hot pack on.
And it's way different if it's laying on top or you're laying on it. The amount of
Yes.
pressure is going to intensify, so you're going to need more layers if you're on it.
Right. Not so much with the fire infrared, but definitely with the standard electric
Yep.
conduction heater. Number 2, never use near your eyes, or there's really no reason to use around your head. I wouldn't recommend. Why, Mike?
Cut some holes
Yeah,
in it.
he's
could
always
have-
playing. That's a
Halloween
problem
mask.
I have with this guy. But one way or another, he's still working out good.
Like we said earlier, never use it directly on frail skin. We have had that with elderly patients before. Be very cautious. They can blister and burn a lot easier, or even start weeping. So
Right.
be cautious.
That's big because when you have a burn from a hot pack, they go deep and they don't heal quickly,
Yes.
particularly with fragile skin. Never use on the abdominal area if pregnant, particularly with the fire infrared. Just stay away
I'm
from it
not pregnant. I'm fine.
another time.
Never on skin with poor sensation. So if you had a stroke, you have neuropathy of sorts. If you can't have good sensation in an area, you should probably not use it on there because, again, you can leave it on too long, get hotter than you think, lead to burns.
Right. Again, the biggest thing is falling asleep. You
Yes.
do not want to fall asleep with these on.
No.
That can cause a burn. And now this one does not get near as hot, but if you fall asleep with this one and you have frail skin and you put it either directly on your skin or on the thin, there's a possibility you could have some problems with it. So be safe. Always use some cloth between
you're
you.
more prone to get burned on like a shallow skin area, not a big muscle belly. So just keep that in mind.
Yeah, exactly. Like over the kneecap where you have skin and bone directly underneath. That's would be a definite hot spot. So again, people who cannot communicate well. Let's say someone had a stroke or there are some cognitive issues and it's hard to get very distinct. Is this too hot? And if they cannot come up with a very yes or no, it's not a good person to use a warm pack on.
Yeah, you never know if it's going to get too hot because the burn doesn't always appear right away. Sometimes it
Exactly.
takes a day to have that happen.
Right.
And never used by water.
Right. And that's pretty obvious. It's for both of them.
Yep. There are some other precautions, like don't have metal with it. They don't suggest using it by oxygen. Basically about it.
Length of time you would typically use these. These we would go 15, 20 minutes max in the clinic.
Yep.
Again, continuing to ask the patient or let them know if it feels too warm, put another layer of toweling or some cloth between it.
And you can use it numerous times a day if you want to do it longer. Just take breaks from it. Don't use it for like 2 hours nonstop.
Exactly right. Now, with this, it takes longer to heat up, but you could actually put more layers of cloth and it'll go right through the cloth anyways. It's still going to get your 2.36 inches minus the cloth. So put that on, and I've tried that with winter clothing on, and I put it on that to test it. Takes about 5 to 10 minutes before you feel the heat, but it gets in there and it's still going to get deep. The other thing is just a hygiene issue. Use cloth between the skin and this so that if you, that's why in the clinic we don't share from one patient to the other direct on skin.
I mean, if you have your own at home, it's fine.
Right.
Also, this one from Walgreens?
Yeah, it's a Walgreens one. Yeah.
It actually comes with all precautions on the back in case you're curious. So
I needed my reading glasses on it. But yeah, they're covering all the ones we had, plus a few other ones that I think were pretty obvious. So again, their far infrared, 45 minutes is what they recommend. To be honest with you, I've had this on my back at home. It's really great in the winter time. I sit like this and I've fallen asleep on it, but I have clothing. I've never had any problem with skin burning, but we don't recommend that naturally.
And if you can't afford it, it's the giveaway. So go sign up on Facebook or on our website.
Right.
Giveaway section.
Absolutely. And if you just go through our website, go through the link, you'll get, I think, $30 off.
Yeah, you'll get
a discount through us, through Bob and Brad, because we're trying to help you out any way that we can. So once again, continue on with this winter weather. Stay warm, healthy, and be careful.
I think it fixed my broken heart.
I don't know if we're going to. We forgot to say that. We have to say.
I just did.
We can fix just about anything.
Except for
a broken heart. And these, we don't have any data yet that it's going to do the trick.
I'll be the
now. There's nobody watching by now. By now, everyone's shut off.
Yeah, pretty much.
Whatever. Thank you if you are watching.